The question is, what's missing?
I've had 7.
What'd you do about food?
I had a feeding tube.
For how long did you have that feeding tube? Been for a year?
For a year, yeah.
Let me ask you a question. When you look in the mirror and you say, this 1 or 2 things bothers me the most that you wish you could just make go away.
My eye.
What about your eye?
I don't have 2 of the same eye.
You have a little unevenness between the eyes?
Yeah. And then they did do a nose surgery. Just the scar tissue on the right side is just really a lot of scar tissue in there. Like if I had to rely on it to breathe, I'd suffocate. And
So you have right nasal airway obstruction.
Yeah.
Could you just tell me a little bit about this emotional journey? Because your mom, who you love more than anything in the world, has a major injury, could have died. She comes home, and what was that like?
I really just don't remember.
You don't remember what?
The details of, like, what I did on a daily basis.
Did you know that? Is this the first time you're hearing that she's blocking out this whole traumatic incident? How do you feel about that?
Not good. It's been hard, but it's more important to me that my mom doesn't see herself as a monster anymore. My mom is my hero.
Before my surgery, my face was destroyed by a motorcycle accident. I had a disfigured left eye and mouth. I also couldn't breathe due to my right nostril being closed off from all the scar tissue. I hated what I saw in the mirror, and I hated what it did to me and my family. But now, thanks to Dr. Nassif, I can breathe. My eyes are more symmetrical, and I can finally look in the mirror and not hate what's looking back at me. I'm excited about life for the first time in a very long time.
Sarcoidosis is an autoimmune disease kind of similar to lupus. For me, it affects my skin. I was 19 years old when my mom started noticing that around my eyes, you could see that it was a little bit puffy, a little bit swollen, and I did a lot of blood tests, but the doctors did not know what was going on. And by 2012, my face started leaning, and it just kept going. I was just like, are you gonna stop? Come on now. And it just ended up being like this, where I have hollowed cheeks. It wasn't until 2015 that a doctor finally figured out that I had sarcoidosis. I had an emotional breakdown. It was really tough. I started going to the doctors, and I've done everything from derma rolling, putting collagen creams on my face. Nothing's happening. I have my angles down packed when it comes to selfies, don't get me wrong. But sometimes I feel like giving up. I'm tired of feeling devastated and pissed off, like, why is this happening? These bones, girl, don't be gone. Because it's time for Juicy Face again. Juicy Face.
Kofa.
Hi.
How are you?
Hi.
Good to see you. How are you doing, lady? So this is my anesthesiologist, Dr. Mess. He's the world specialist in this facial filling process for you. I mean, he's the guy who got the stuff FDA approved, okay?
I'm excited.
I'm super excited to help you out.
Living with sarcoidosis is very challenging. My face is skin and bones. So I'm just curious to see what I'm gonna look like.
So, Kofa, what's nice about this, she has some immediate filling with the hyaluronic acids, and then the long-term, basically your body producing your own collagen from Sculptra. Injecting Kofa, we can definitely feel the damage that the sarcoidosis has done. Usually when you put in a needle and inject, the needle goes back and forth real easy. However, with Kofa, the needle is not flexible, and there's a lot of ridges on the cheek. These are all signs of some inflammatory process that has occurred in Kofa's face.
Smile for me.
And this is just the beginning.
That's just the beginning.
Wow.
My face has regained its fullness. I look like myself again, and I feel great. My juicy face is back.
The question is, what's missing? So basically, you have some remnant of muscle here. You have nothing right here. It's pure skin graft on bone. You have some remnants of soft tissue here. Another option is to make an incision across your entire abdominal wall, extending into the unaffected right side. It'll have a better shot at matching the left side.
Right.
The advantage of that is you probably don't love this little extra lax tissue. No. It's a tummy tuck on a guy.
Okay.
Big downside is complications. I mean, there's a big difference between working on this smaller area, although substantial area, than lifting everything up, doing a full tummy tuck, but I'm willing to go after it. If you're willing to go after it. If you want to do the whole thing,
yeah,
I'm there for you. I'll do the whole thing.
I think the best option sounds like, you know, even though it's a bigger risk, probably do the whole thing and try to make it look as symmetric as we can. Before my surgery, there was a big gaping hole in my side, but now, thanks to Dr. Dubrow, the hole is gone. I have symmetry, and I'm no longer in pain when my work belt rubs against my side or anything. There's no way you could possibly tell what my side looked like before. And I'm back to dating again, and it just feels amazing.
Meet Paisha.
Paisha has a bad
A couple
problem.
of years ago, had a little spot on her right upper lip area. Bottom line is she ended up with this complete horrible deformity.
How fixable is this, by the way?
Yeah, well, let's see, let's get her in. Can you please send in Paisha?
Paisha, tell us what happened.
Well, I actually went to take my son to the dermatologist because he was struggling with some acne, and I asked her, I said, can you check this out underneath my nose? I had a couple little bumps that were clear that I thought were probably some clogged pores, but it was basal carcinoma, and it would be 1 to 2 stitches. So I really...
They were gonna punch it out, probably.
Exactly, like it was just gonna be super simple. They scheduled it for 2 weeks later. I went in to the dermatologist's office.
I didn't even go with her.
Yeah, he wasn't with
There wasn't
me.
anything alarming.
He went in and cut the first margin and came back and said, this is more than we thought it was. It was
Right then.
Right then.
Paisha underwent a cancer-removing procedure called Mohs surgery. You only want to take out just the cancer cells. You take out small slices at a time, look at it under a microscope, and then continue on till you've cleared that zone.
He said it was kind of like a iceberg,
Right.
where he said it looked like a little bit on top and it was more spread out underneath. He proceeded to do it 6 times.
Yeah.
I think she called me at that point, just in tears, just like, I don't know what happened. She lost it.
And he came back, said, okay, looks like we've got it all, and literally told me, don't worry, we're not gonna cut you loose. We're gonna find a plastic surgeon to repair the damage. Then I'm like, oh, a plastic surgeon? Like, what in the world is going on here?
From the nose all the way to the lip was gone, and then it was peeled out.
Just splayed open. So it
Splayed
kind of
open,
after that cut, it just
exactly.
went shh, like that.
Exactly.
If you take a look right here, so if we can maybe lift all this up, try to debulk some of this even down here, that will hopefully, 1, get rid of some of the fullness, 2, give us a little bit of lift like that. So our goal would be to make the upper lip look more natural and normal.
Okay.
And that's not without risks,
Oh, I know.
because I can kill the flap and I can kill all that tissue. Today for Paisha's surgery, I'll start by performing a commissuroplasty by making an incision along the right corner of her mouth. We'll cut and transect the muscle and extend the 2 edges all the way to the corner to widen the opening of her mouth. Next, we'll harvest some marone fat to transfer into the small depression on her lower right side of her chin. Then I'll make an incision along her old scar by her nasolabial fold, lift up the skin graft, and debulk it as much as possible. Lastly, I'll perform a direct lip lift on the right side where she lost the most lip tissue to make her lips look more symmetric. This might be her natural lip.
Yeah.
I'm going to make an incision for the commissuroplasty. So we're going to take the muscle, stitch it to its new corner. This is really important because this muscle, we're creating, you know, the new opening for where her lip should be. If I ruin that muscle around the mouth or it's not able to be fixated to the corner of the lip, the mouth function will not work and the lip will shorten. All right, so time for a little fat grafting. And let's see how it looks. Wow, that's friggin' beautiful. Paisha is gonna be really, really happy with this.
Are you nervous?
I'm so excited.
You should be. And this medical tattoo is the final step.
Okay.
All right, ready? Don't start crying.
No, she's numb. She's gonna be good.
Looking back from the way I felt when this first happened, I didn't look the same anymore. It took away my identity. It took away who I was. Now, since Dr. Nassif has done the surgery, my life has changed so much.
Get set and go.
That's incredible.
Bravo.
Thank you. Congratulations.
Before my surgery, my face looked like a Halloween mask. I had almost lost my entire lip to cancer. It was scarred and tight, and I didn't even recognize myself when I looked in the mirror. But now, thanks to Dr. Nassif, I can open my mouth more, and I have lips. I can kiss my husband now. We're definitely getting better lip action in.
The only time I've seen someone get relief from headaches is when I saw the septum so badly deviated that it's touching the side of the wall in the turbinates. Here it looks like it's touching everything. I would hope that you get some relief. However, you are going to be one of these patients, which is rare for me to say, that I really don't know exactly what's happening inside your nose until I go in surgery. So I cannot give you a plan right now except take rib cartilage, open up your nose, look and see what's going on, and start from there. I'm not convinced that this is from an IUD.
I agree.
I'm more convinced that this was a congenital issue. Your left side developed normally, your right side didn't. The baby's gonna be moving around all the time, swimming around in that uterus. It seems a little hard to believe that an IUD can just sit on a baby's face the whole time and cause that kind of damage.
My whole world changed. You know, I've been told this all my life. Now you're telling me it's this other congenital problem.
It almost does look like a cleft lip nasal deformity.
On that whole side. Because even if you did have an IUD pushing on your nose, it's not going to cause this bone to be way outside over here. It's just not going to cause some of these defects. Let me give you a little bit more information. The point is you're missing bone and cartilage. And no matter what, your septum is horribly deviated. We got to fix that. Because if I can get your headaches better, and I don't know if I can, but get your breathing better, get your lifestyle better, that right there, opening up your right airway, is going to do so much good for you. So I want to do that, no matter what, as long as you give me the permission.
I think I need it. It's hard to hear that the problem is congenital, but if there's a chance to fix some of the, maybe the aesthetic problems and fix some of the health problems, I feel very hopeful. Before my surgery, my nose was absolute trash. It wasn't symmetrical, it was shifted to the left. I couldn't breathe, and I was having horrible headaches. I hated looking in the mirror, and I thought that my deformed nose was all that people would see when they'd look at me. But now, not only did Dr. Nassif give me a symmetrical, functional, and good-looking nose,